I'm excited to share with you an interesting interview. Together with me is Tobias Richter, the CEO and founder of TRI Dental Implants, a Swiss leading company on the dental implant domain. Let's start with you telling us a little bit about TRI Dental Implants.
TRI Dental Implants, as you said, is a provider of digital implant solutions from Switzerland. And we pride ourselves to actually have developed the world's first dental implant that can be restored without an abutment. Or, as we like to say, the first digital implant that is made for CAD/CAM and 3D printing restorations. It's the first time that an implant company has provided this. Any other implant company worldwide always needs abutments to restore this. So what you can do now, if you have a printer, for example, you can place the implant, you can scan it, you can print it and insert the crown after 1 hour without abutment, without cement, without limits.
Tobias, maybe you can share with us a little bit about your app market solution to the implantology.
The fact that we don't have an abutment anymore means that we think much more about workflows on top of the implant. Maybe I can make the analogy to an iPhone. The implant in the end is like an iPhone, and we have developed clinical apps with which you solve certain clinical workflow problems. One, for example, Scan and Smile, printed crown in 1 hour. A digital healing collar library with 48 digital healing collar designs. A scan bridge for a 20-second scan of a full arch edentulous person. We are changing the mindset on the way we approach implantology by thinking much more in terms of software solutions that apply to the implant. And it's only possible because we're the only company worldwide that doesn't have abutments and where we restore directly on the implant.
I wonder if you can share with us, what do you believe are the most important trends in the dental implant domain right now?
The fact that we can place, scan, print, insert after 1 hour is only possible because digitalization has advanced. A, intraoral scanners have started. B, we have now 3D printers with which we can print material at the same time for a cost of $1. And thirdly, we have the CAD/CAM machines which have become more precise. Our innovation of having the world's first implant without abutments is only possible because the machines have now a precision of 3 to 5 micron. So if you ask me for the trends, digitalization will revolutionize this industry, and we will revolutionize the implant industry with our technology.
I want also to ask you, Tobias, what would you advise or what kind of tip would you give to a dentist that is afraid to try something new?
So first of all, I would recommend to any dentist to actually invest in digital equipment because it makes workflows easier, it increases precision, and it drives actually profit for the dentist. Secondly, in terms of what the dentist should consider is that not be afraid of digitalization, but actually embrace it as a way of standardizing your workflows. Because I think it's quite strange that we think we control dental medicine and yet don't use digital equipment, which by nature is more precise. The second point is concerning, if someone is afraid to use our implant because we go a new way, we have to remember that we have built this on the basis of 20 years of experience. The implant body has an experience from many years. We have been applying all the material sciences that are there for 20 years. What we've done is only think, how does digital work in terms of precision techniques, and have applied this. There's no risk really associated to it, and I think the advantages of having in a simpler workflow, having more predictive results and more precision, and having ideally more money because it drives profit is something that's worthwhile embracing.
Thank you, Tobias, for having with me this interesting interview.
Thanks a lot, RC, and you're welcome to come to Switzerland to visit us. But before, you have to finish the video.
Totally correct. Thank you.